All right, it's a beautiful morning to you, and you are welcome to Lagoon Radio, broadcasting live to you from Marina, Lagos. And this is officially welcoming everyone to this edition of El Talk Show on Lagoon Radio. My name is Simidele. Okay, how you all doing? How is your day going? Hope you're feeling all right. Yeah, health is wealth, so that's why I don't joke with health, and I don't joke with health talk. Yeah. So last week we discussed a very interesting topic, and that was hydronephrosis, and we gave us extensive should I say lecture now? Okay, we discussed extensively on hydronephrosis, and today we want to look at another should I say another exclusive topic here on Lagoon Radio, and that is hernia. A lot of people, you just hear hernia, and some even think hernia is only meant for men. But no, today we want to prove to you that hernia is meant for both men and women as well. And the your symptoms, or let me say your gender, actually determines your symptoms, really. So we're really going to go deep into that. Yeah, a very big thank you to my producer here in the studio, Abel Abi Nina. Let me call you like Shab Inina. Yeah, a very big thank you. She'll be producing me on today's show today because I can't produce myself now, So she's actually my producer for today's show. All right, fasten your seatbelt as I'll be taking you on this exciting ride here on Lagoon Radio. Don't forget to follow us on all our social media platforms: Facebook, Lagoon Radio Nigeria, Instagram, Lagoon Radio NG, and if the ban has been lifted on Twitter, we're also on Twitter at Lagoon Radio NG as well. And you can subscribe to our YouTube channel on LagoonTV. And for more news update, you can catch up with us on lagoon.news. All right, let's go on this quick music break, and we'll be right back. Fasten your seatbelt. Stay connected to Lagoon Radio. Don't go anywhere. Wade in the water, we did wade in the water, children, wade in the water. God said he's gonna jump in the water. Wade in the water, we did wade in the water, children, wade in the water. God's gonna jump in the water. We are the sons and the daughters. We gotta stand up and make it loud, just like our God told the Pharaoh. We are a new generation from the ones who have come before. He's calling us into freedom. Let my people go. Wade in the water, we did wade in the water, children, wade in the water. God said it's gonna jump in the water. Wade in the water, we did wade in the water, children, wade in the water. God's gonna jump in the water. We are the sons and the daughters. We gotta stand up and make it loud, just like our God told the Pharaoh. Let my people go. We are a new generation from the ones who have come before. He's calling us into freedom. Let my people go. We don't go shine, never shake. Give me a papa God where you make the heavens. If you don't say you know what trouble, let my people go. The blood, sweat, and the tears that we gathered through the years. If you don't say you know what trouble, let my people go. Wade in the water, we did wade in the water, children, wade in the water. God said he's gonna jump in the water. Wade in the water, we did wade in the water, children, wade in the water. God's gonna jump in the
You are listening to Lagoon Radio. This is
You are listening to Lagoon Radio.
All right, you're welcome back, and the time is 13 minutes past the hour of 11 a.m. And this is still your favorite health talk show here on Lagoon Radio. Okay, like I earlier said, I said the way male suffer from hernia, so female too, and children as well. So, and it shock you. Okay, so and we're really going to be trashing that out. Okay, let me give you a brief overview of what hernia is. Um, Hernia is a kind of it occurs when an organ or a fatty tissue squeezes through a weak spot in a surrounding muscle and connective tissues. And these connective tissues are called fascia. And the most common types of hernia are the inner groin, that's the inguinal hernia. We also have incisional. Incisional is a type of hernia that resulting from an incision. We have femoral, that's the outer groin, and we have the umbilical hernia, that's the belly button hernia. We also have the upper stomach hernia as well. And for the inner groin hernia, that's when the intestine or the bladder protrudes through the abdominal wall into the groin canal, and about 96% of all groin hernias they're actually inguinal, and that's why it's basically called that name. And um, most of this condition occur in men because of this kind of natural weakness they have in that area, that's their groin area. Then for incisional hernia is when the intestine pushes through the abdominal wall at the site of previous abdominal surgery. And this type is most common in elderly people, in overweight people, that's overweight people that are inactive after abdominal surgery. So like maybe you have a kind of, let me say, appendectomy, sorry. Appendectomy is an abdominal surgery, and as an overweight person, if you go through that kind of surgery, that's appendectomy, and after the surgery you become inactive, or you're saying because of the pains you can't move, you just want to sit in a place and be eating. After you eat, you lie down to sleep and all that, you are at risk of developing incisional hernia. Then for the femoral hernia occur when the intestine enters the canal carrying your femoral artery into the upper thigh. And femoral hernias are most common in women. The groin hernia is common in men, while the femoral hernia is common in women, especially those women who are pregnant or women who are obese. Femoral hernia is actually common among them. Then for umbilical hernia, it's when part of the small intestine passes through the abdominal wall near the navel, and this umbilical hernia is common in newborns, and it also commonly afflicts obese women. I think this is actually the second time I'll be mentioning obese women, and also common in those who have had many children as well. They are at risk of developing umbilical hernia. And for the hernia of the hernia in the upper stomach, is called the hiatal hernia. It happens when the upper stomach squeezes through the hiatus and creates an opening in the diaphragm, through which the esophagus passes. So that's for the hiatal hernia. So what causes hernia really? What actually causes this? All hernias are caused by a combination of pressure and an opening or weakness of the muscle. So the pressure pushes an organ or tissue through the opening or the weak spot. And sometimes the muscle weakness is present at birth, but more often it occurs later in life. Like for those who did not experience umbilical hernia, it could happen to them later in life. And anything that causes an increase in pressure in the abdomen can cause hernia. Like anything that increases the pressure in your abdomen, like bloating. There are some set of people that whatever they eat, they just bloat. Like any small thing they put in their mouth and swallow, they bloat. So we're really going to be looking into that. So like I said earlier, anything that causes an increase in pressure in the abdomen can cause hernia. Surgery too, like I earlier said, can cause hernia as well. And what are these anything that causes an increase in pressure in the abdomen? We have lifting heavy objects without stabilizing the abdominal muscle. We have diarrhea, constipation. We have persistent coughing or sneezing. We have bloating. We have indigestion. Anything that causes increase in the pressure of your abdomen can cause hernia. In addition, we have obesity. We have poor nutrition, smoking as well. All these can cause muscle weakness. They can all weaken the muscle and make hernias more likely for a person. Okay, let's briefly look at the symptoms of hernia before we go on another music break. What are the symptoms of hernia? Your symptoms depend on the type of hernia. Like I earlier mentioned, the 5 types of hernia, but in some cases, you may not have symptoms at all. For the groin, for the femoral, for the umbilical and incisional hernias, we could have symptoms like swelling beneath the skin of the abdomen, and this swelling could actually be very obvious. It could be obvious, and it may be tender as well, and it may disappear when you lie down. So maybe when you stand, you can feel a kind of swelling under beneath under the skin of your abdomen. It's actually a symptom of hernia. It might not be hernia, but that's one of the symptoms. So if you're feeling if you're feeling a kind of swelling under the skin of your abdomen, there's no cause for alarm. You just need to seek medical attention immediately, really. And also another symptom is a heavy feeling in the abdomen that sometimes comes with constipation or blood in the stool. You might not necessarily see blood in your stool, but that constipation, when you have that heavy feeling in your abdomen and at times it comes with constipation, that it's another symptom of hernia. Then discomfort in the abdomen or discomfort in the groin when lifting or bending over. That's another symptom. Then when you have a burning or aching sensation at the bulge, that we a bulge is when we look at a man's anatomy, we have some areas that are actually encompassed in that side. We have the abdominal wall, we have the scrotum, we have the intestine. That's the intestine protruding into the groin canal and all. We have the pubic bone as well. Okay, moving forward, I mentioned burning or aching sensation at the bulge. Then we have weakness or pressure in your groin as well. Heartburn is a symptom of hernia. Then when you have a hard time swallowing is another symptom. Shooting pain, vomiting, constipation, pain and swelling around the testicles is a symptom in men, really. And we also have some other symptom of upper stomach hernia, and that's the hiatal hernia, which could include heartburn and upper abdominal pain, because we have a lot of people that suffer heartburn, especially when they eat, when they take in anything, should I say, acidic. Maybe when they drink gari, or at times when they eat beans. Some will say, "Oh, I do have heartburn when I eat beans," and all that. So There's some too that experience upper abdominal pain as well. It's actually one of the symptoms of hernia. Then we also have strangulated hernia symptoms. Usually you can push a hernia in, maybe anyone that has hernia, it can be pushed in, but sometimes you can't push it in because it can get stuck in your abdomen. And if the trapped part gets cut off or strangulated from blood flow, it's a very serious situation and can be life threatening as well. So you need to get medical advice. You need to get in touch with your doctor right away if you have any of the symptom of a strangulated hernia, such as nausea, vomiting, fever, sudden pain that gets worse quickly, hernia bulge that turns red, or hernia bulge that turns purple, or even bulge that turns dark. And then if you're not being able to poop or pass gas, please consult your doctor immediately. Okay, let's briefly go on this music break and we'll be right back to discuss hernia signs and symptoms in children. Remember, I told you that we have children who suffer from hernia, and the basic ones in children are the umbilical one. We have the umbilical hernia and the groin hernia as well. Stay connected to Lagoon Radio. We'll be right back.
You're still the reason for my living. You're the one who works and needs to come. All creation bow before you. Lord, I praise you, make them fire. You're the glory in my song. Lord, I worship, yes, I worship. You are the living God. Alpha and Omega. Hey, Alpha and Omega. Alpha and Omega. I worship you today. Hey, yeah. Oh, oh, oh. Alpha and Omega. Yes, I worship you. I lift my voice to you.
All right, you're welcome back. And you're still listening to Lagoon Radio, broadcasting live to you from Marina, Lagos. Don't forget to follow us on all our social media handles, Facebook, Twitter, and Instagram. Lagoon Radio Nigeria for Facebook, and for Twitter and Instagram, Lagoon Radio NG. I'm actually hopeful for Twitter, really. Okay, and you can also check us out on our website on www.lagoonradio.ng, and of course, our YouTube channel, LagoonTV, and for more news update, lagoon.news. You're still on to the Air Talk show where we've been discussing hernias, and we've talked about, we've given a brief overview of hernia, and we talked about the different types of hernias, the symptoms of hernia in men and women, and what are the symptoms of hernia in children. Growing hernia in newborns or inguinal hernia in newborns and children is as a result of weakness in their abdominal wall at birth. That weakness is actually present from birth, and sometimes the hernia will be visible only when the child is crying, or when the child is coughing or straining during bowel movement. That's when it can be visible. And this child might be irritable and have less appetite than usual. But in older children, hernia is likely to be more apparent when the child coughs or when the child strains during a bowel movement, or when the child stands for a long period of time. So those are actually the signs and symptoms to watch out for in children. Okay, if you're unable to push the your hernia in, the contents of the hernia may be trapped. It's called incarceration. It could be trapped in the abdominal wall, and the incarcerated hernia could become strangulated, which cuts off blood to the tissue that is trapped. And a strangulated hernia can actually be life-threatening if left untreated. And there are signs and symptoms of strangulated hernia, and I think I've mentioned that before. Nausea, vomiting, even both. Nausea is different from vomiting, really, but I think a lot of people actually, should I say, misinterpret that. Nausea, vomiting, both. Then fever, sudden pain that quickly intensifies. Then inability to move your bowel and pass gas as well. And there is a quick advice for everyone. If a bulge in your hernia turns red or turns purple or turns dark, or if you notice any other symptom of a strangulated hernia, you need to seek medical care immediately, and you need to see your doctor if you have a painful or a noticeable bulge in your groin or either side of your pubic bone. And if this bulge is likely to be more noticeable when you stand, and you can usually feel it if you put your hand directly over the affected area. Okay, what are the causes of hernia? What are the causes of this thing we've been talking about since morning? Inguinal hernia has no apparent cause, really, and other hernias might occur as a result of increased pressure within the abdomen, a pre-existing weak spot in the abdominal wall, like I earlier said. If there is a weak spot or a weak muscle in the abdominal wall, it could actually cause hernia. Then straining during bowel movement or urination. There's no need for you to strain if you want to urinate, except if that person is suffering from a urinary tract infection or any other kind of urinary infection. That's when one could just strain. Maybe when you're feeling pressed and you can't pass out urine easily as a result of infection, then it could cause you to strain. But straining is not the best option, really. Then straining during bowel movement. There are a lot of people that strain during bowel movement. Maybe you're feeling pressed and you're not as pressed as you should, and you just want to let the thing out, and you just go to the restroom, you go to the loo, and you start straining. It's actually very bad, and it could cause hernia. Then strenuous activities, weightlifting, anything that could actually stress you, it could cause hernia. There are people that lift weight for a living, but at the same time, it needs to be watched, because anything that makes you strain your muscle, it's a no, no, no. Then pregnancy as well is another cause of hernia. We pregnancy issue is actually is in a very different world on its own, because pregnant women are experience a lot of things. That's when you see preeclampsia, hernia, a lot of things like that. Not for anything, but because the muscle on the abdominal wall actually is being stretched during pregnancy. Like as the fetus grows, the muscle keeps stretching, and that is that. Then chronic coughing or sneezing, it could actually cause hernia. And in many people, the abdominal wall weakness that leads to an inguinal hernia occurs prior to birth, when a weakness in the abdominal wall muscle doesn't close properly, when there is an opening in the abdominal wall muscle. And other inguinal hernias develop later in life, when muscle weaken or deteriorate due to aging, strenuous physical activities, coughing that accompanies smoking as well. And weaknesses can also occur in the abdominal wall later in life, especially after an injury or after an abdominal surgery. I said that at the beginning of the show. Then in men, the weak spots usually occur in the inguinal canal, where the spermatic cord enters the scrotum. And in women, the inguinal canal carries a ligament that helps hold the uterus in place. And hernias sometimes occur when connective tissues from the uterus attaches to tissue surrounding the pubic bone. So as hernia affects men, it also affects women. Then we have some risk factors of factors that contribute to developing hernia. And it includes being a male, being older, being white, family history, chronic cough, chronic constipation, pregnancy, premature birth or low birth weight, previous hernia repair. There are also risk factors. And being male, men are 8 times more likely to develop hernia than women, because basically what actually causes hernia in women is maybe overweight, obesity, pregnancy really could actually cause hernia in women. But in men, men are 8 times more likely to develop hernia than women. Then being older, the muscle weakens as you age. So as you age, you stand a risk of having hernia. Then being white as well, it's another risk. Then family history. If you have a close relative, maybe your parent, your sibling, who already has that condition or who have had that condition before, you are more likely to develop hernia. Then chronic cough, maybe cough caused by smoking. It's another risk factor. So smokers are liable to develop hernia as well. Then chronic constipation, that's constipation that causes straining during bowel movement. It's another risk factor, because as you strain, your muscle is actually being strained. Then pregnancy. Being pregnant can weaken the abdominal muscle and cause increased pressure inside your abdomen. Like I earlier said, like as the fetus grows, the pressure increases, the abdominal muscle stretches, which actually ends up, and that's why you see like, should I say 95% of new mothers, maybe women who just put to bed, you within the first 2 weeks you see their stomachs kind of zagging, like the muscle has been stretched and the muscle is weak. So then premature birth and low birth weight as well. And this hernia is actually common in babies who are born prematurely or babies who have low birth weight. There are some babies that at birth they weigh 1.2, 1.5 and thereabout. Then previous hernia repair. If you actually undergone an hernia repair before, you actually stand the risk of developing hernia, because even if your previous hernia occurred during childhood, you are at a higher risk of developing another hernia. We have some complications of hernia as well. Pressure on the surrounding tissues, because most hernia enlarge over time if not repaired surgically. In men, large hernias can extend into the scrotum and causing pain and swelling. We also have incarcerated hernia. That's another complication. That's if the content of the hernia becomes trapped in the weak point of your abdominal wall, and this content can obstruct your bowel, leading to a very severe pain, and could also lead to nausea, vomiting, and inability to have a bowel movement and inability to pass gas as well. Then we have strangulation. An incarcerated hernia can cut off blood to part of your intestine, and strangulation can lead to death of the affected bowel tissue. And a strangulated hernia is a life-threatening one and requires immediate surgery. Yeah, what are the ways to prevent hernia? You can prevent hernia, but you can't prevent the congenital defects that makes you susceptible to hernia, and you can reduce strain on your abdomen and tissues as well to prevent hernia. For example, what are the ways? You need to maintain a healthy weight. Talk to your doctor about best exercise and diet that are actually fit for you, like a particular diet plan for you. That your friend is on keto doesn't mean you should be on keto. That your friend is on intermittent fasting doesn't mean you should be on intermittent fasting. Just talk to your doctor or speak with a nutritionist to get something that is best for you. Then you need to lay emphasis on high fiber foods like fruits, like vegetables, like whole grains. All this contain fiber that can help prevent constipation and straining as well. Then lift heavy objects carefully and avoid heavy lifting. If you must lift something heavy, bend from your knees, not your waist. Lift heavy objects carefully, or if need be, avoid heavy lifting. But if you must lift something heavy, always bend from your knees. Do not bend from your waist. And if you see that there's a what you want to lift is kind of heavy, you could seek for assistance. Let someone help you lift it on your head. And while you're lifting it, you bend from your knees and not bend from your waist. Then stop smoking. Stop smoking. Apart from the role of smoking in many serious diseases, smoking always cause a chronic cough that leads to or aggravates an hernia as well. Okay, briefly, let's look at how you can tell if you have hernia. First and foremost, it is very important to understand that both men and women can develop hernias. Yeah, but people often believe that they often believe that it's only men that get them. Like before I started this show, I told someone about the topic I was about to discuss, and she was like, "Oh, that thing that used to affect men." I'm like, "No, it doesn't affect men alone. It affects men. It affects women. It affects children as well. No one is left out." But the thing is, for anatomical reasons, men have a higher risk, but women can certainly have too. And many experts agree that women are likely underdiagnosed for this particular condition because they tend to have different symptoms than men. I said symptoms of hernia is actually gender-based, and women may not have a noticeable bulge. But if symptoms indicate a possible hernia, and your doctor cannot confirm it by examination, an MRI test can actually provide a definitive evidence. It's actually it's a best shot. It's the best shot. So what are the treatments of hernia? We have surgery. We have surgery because hernias in women are more likely to become emergencies because women also have a greater chance of developing complications than in men. And like I said, pregnancy. A pregnant woman might actually be suffering from hernia, but she wouldn't know because she's pregnant. Her body is changing, and she knows that her body is actually changing. So she wouldn't even know at all. So, and that's why it's kind of difficult to diagnose women than men. So women are often underdiagnosed because you can't just tell a pregnant woman to come for hernia surgery when you know there's a fetus in there trying to grow. But typically, repair surgery is actually recommended after diagnosis. But for pregnant women, they are actually allowed to put to bed first before the surgery. And we have two surgical treatments. We have the minimally invasive surgery. We have the minimally invasive robotic surgery. The minimally invasive surgery is often performed through a laparoscopy, and it requires only a keyhole size incision through which a tiny camera and an instrument can be inserted to make repairs. Then for the minimally invasive robotic surgery, it's similar to laparoscopy, but surgeons use a controller to move this instrument, and is actually an option as well. And with this, with minimally invasive surgery, patients are back to their regular activities within 2 weeks. Within 2 weeks of surgery. And we also have open surgery. Open surgery is another treatment option, and for open surgery, patients recovery is between 4 to 6 weeks. Then what are the signs of hernia emergency? Like, when should you know that, oh, this is a case of emergency? When most hernias start, the internal tissues that push it through the muscle gap is usually fat, but it's possible for part of the bowel to protrude through the opening, and the risk of this is very low. But when it happens, it needs emergency repair, and you must seek immediate medical attention if you have this following things. If you have a painful bulge that doesn't reduce in size when you lay down to rest, then if you're experiencing a worsening pain, nausea or vomiting, difficulties having bowel movements, bloating, racing heart rate, fever. There are a lot of people that will be like, oh, I think I have palpitations. Not all racing heart rate is palpitation. It could actually be a sign of hernia emergency. And fever as well. Maybe you feel feverish, you went for tests, malaria, parasite test, wider test, do your full blood count test and all that, what have you, and you're still feeling feverish. Please go for other tests too, in order to diagnose if you have another ailment. All right, that will be all on today's edition of El Talk on Lagoon Radio. Do join us same time next week on as we discuss another fresh topic. Of course, next week is going to be a new month, so we'll take it a very, very new terrible topic for you here on Lagoon Radio. Don't forget, our website is www.lagoonradio.ng, and our Facebook handle Lagoon Radio Nigeria, and Instagram Lagoon Radio NG. And of course, to catch up with this El Talk show, you can follow us on our YouTube channel, LagoonTV. You're going to watch it live, and you're not going to miss anything. And once you go to our YouTube channel, you subscribe and turn on your notifications as well. And you can also catch up on lagoon.news, just to get a brief summary of what we discussed today. Okay, that will be all for today. See you same time next week. My name is Simidele. Okay, bye.
You are listening to Lagoon Radio.